Thanks, Mark. It's always hard to follow such an energetic and entertaining speaker. I'm going to be coming or making comments or soliciting questions more in line with my clinical and public health background. My training actually and my clinical experience has been primarily in primary care, working with patients who are members of various minorities and immigrant groups. And wanted to reinforce a little comment that Mark made, was that within family groups, many people enjoy a variety of labels regarding whether or not they're refugees or immigrants or migrants. These are political terms, and they vary even within nuclear families. And they're very important terms because they imply certain kinds of rights, and from my perspective, the rights to health care. And depending on what kind of label people come with, depends on their ability to access appropriate health care. I also spent 13 years working over at Student Health, and while you may or may not realize that this university has at least 3,000 international students every year, and within that group, we also find some of them are actually refugees and or people who are potentially immigrating here. They're just sometimes lucky enough to have the background to be identified as students while they're literally fleeing from some other very untenable situation, or they're on pins and needles because other members of their family who were unable to flee, who didn't have the ability to access the university, are sitting at home waiting for the bombs to fall or waiting for the disaster to hit them. I also learned while working over at Student Health, I hadn't realized it in earlier jobs because they were low-income oriented clinics, but how when you don't have access to health care, you may actually just borrow somebody's identity to gain access, and that, as you can imagine, can at times create some real problems in terms of quality care. First for the person whose identity they're borrowing, and for the person who's using the borrowed identity. And this is a problem we see across the U.S. healthcare system right now with the peculiarities of our public-private non-system. And I think we'll all be watching very carefully to see how that works out in the new and evolving healthcare reforms. And thirdly, Pete mentioned my relationship to Physicians for Social Responsibility. We have a very large program attending to social justice issues, particularly social justice issues as they impact people's health and well-being. And within that sort of head, I spend a lot of time exploring the global political, economic, and environmental drivers of migration, particularly the threats of violent conflict. While we know full-fledged wars are going down in number, problems with violent conflict continue to break out in many parts of the world in different frameworks, but nevertheless driving populations either as internally displaced or to seek to cross borders and become refugees or migrants. As well as our changing climate and environmental degradation. All of these are promoting mass movements of people around the world. And so how to respond to the stranger at the gate, how to attend to their needs, is really a challenge that's being faced by all Western societies, advanced Western societies. This isn't something unique to the United States, certainly not unique to Iowa, but rather a global phenomenon. And in general, I think what's important to remember is that this migration, this global phenomenon, is really reflective of what is now a very inequitable, very unequal, full, and degraded planet. And this is a phenomenon that is not going to be stopped by walls. Any solutions to the problems, or if you see them as problems of migration, have to first acknowledge that it really is a complex phenomenon, and that it's going to require creative, not punitive, humane, sustainable, and life-supportive interventions at multiple economic and political levels, both here at home, not just in the state of Iowa, not just in the United States, but really abroad. This is a global phenomenon that's going tackled just like we're trying to tackle so many of the other mass events that are occurring. So the lens, for me, the lens of human rights and global health is one such route to addressing problems with migration. And I promised over at the Center for Human Rights that I would reinforce the announcement about 800-mile wall film screening tomorrow night, which is why I wanted to close with just saying a wall is not going to be the solution. And I'm happy to address any questions people have regarding health or health-related matters for our growing